In ancient times, people used many medications but didn't understand how they worked. But aspirin was the turning point. It was the first synthetic drug with predictable, repeatable, and measurable effects, acting through a specific physiological process rather than mystical or symbolic beliefs. That's why the discovery of aspirin is considered the birth of modern pharmacology. Aspirin, also known as acetylsalicylic acid, remains one of the most prescribed medications even today, despite being discovered in 1897. Aspirin stops inflammation. It blocks two important enzymes, COX-1 and COX-2. COX-1 inhibition prevents clot formation because it stops platelets from sticking together. COX-2 inhibition decreases the synthesis of inflammatory molecules, mainly prostaglandins, which reduces pain, fever, and inflammation. If we ask how effective aspirin is, yes, it's effective. It reduces platelet stickiness by about 95%, and since platelets cannot regenerate, this effect lasts for their whole lifespan, around 7 days. This property makes aspirin useful in treating and preventing heart attacks. Aspirin can reduce fever by about 2 degrees Celsius when the temperature is high. It decreases pain intensity by around 50% and reduces swelling and inflammation by about 30%, but only in higher doses. However, together with these benefits, aspirin increases the risk of bleeding by about 3 times, especially from the stomach. Sometimes, this bleeding can be severe or even life-threatening. That's why it's important to know when and how to use aspirin, and when to be careful. The most common everyday uses of aspirin are for headache, toothache, and joint pain. But aspirin has risks. It can increase the risk of stomach bleeding and worsen stomach ulcers. That's why safer alternatives, such as paracetamol and ibuprofen, are often used. They are almost as effective but cause less stomach irritation. If a person is generally healthy and has no stomach problems, aspirin can be used in these cases. The typical dose is 325 mg every 6 hours as needed, but do not exceed 4 grams per day. The second common use of aspirin is for fever or flu symptoms. It works best when the fever is caused by inflammation, such as in viral infections. However, in children and teenagers under 18, aspirin is strictly avoided because it can cause a rare but severe reaction called Reye syndrome, which affects the liver and brain. That's why, for fever, the first choice is paracetamol, not aspirin. Aspirin can also help with menstrual cramps, back pain, and muscle aches, because it reduces prostaglandins, the molecules that cause pain and swelling. However, ibuprofen or naproxen are usually more effective for these types of pain and cause less stomach irritation. Aspirin may be taken occasionally, but it should not be used as a daily painkiller. There are several situations where aspirin is superior to other painkillers and provides unique medical benefits. Aspirin is the most effective drug for preventing blood clot formation, and its effect lasts for about 7 days, the full lifespan of a platelet. If a person chews one 300 mg tablet of aspirin during a heart attack, it can reduce the risk of death by about 23%. No other non-steroidal anti-inflammatory drug, NSAID, can achieve this. That's why aspirin is included in international guidelines as a life-saving medication during a heart attack, acute myocardial infarction. The second most important use of aspirin is in migraine headache. At a high dose of 1000 mg, aspirin can completely relieve migraine pain in about 52% of patients, according to studies. Ibuprofen and naproxen are also used for this purpose, but they are less effective, helping around 40% of patients. The main risk of aspirin is stomach irritation and bleeding. Aspirin increases the risk of stomach bleeding about 3-fold. While ibuprofen increases it by 1.5 times, and naproxen by about 2 times. So, while other NSAIDs are not risk-free, they are less risky than aspirin. You can reduce stomach risks from these drugs. Always take them with food or milk. This can cut stomach irritation by about 50%. If you combine them with proton pump inhibitors, PPIs, such as omeprazole, the risk of bleeding drops by up to 80%. However, never take 2 NSAIDs together, for example, aspirin with ibuprofen or aspirin with naproxen, because this multiplies the bleeding risk. Aspirin and other NSAIDs can also stress the kidneys, because they reduce kidney blood flow by blocking prostaglandins. It is impossible to eliminate aspirin's bleeding risk completely, because its mechanism, blocking COX-1, removes the stomach's natural protection and prevents platelets from clotting. That's why, even if you take aspirin with food or omeprazole, a small risk of bleeding always remains for about 7 days after one dose. For other NSAIDs, this risk usually lasts about 1 day. According to modern guidelines, aspirin remains one of the most life-saving drugs in cardiovascular medicine. During a heart attack, it is mandatory, a person should chew one 300 mg tablet immediately. This simple step reduces the risk of death by about 23%, because aspirin stops new clots inside damaged arteries. It works within minutes, absorbed directly through the mouth. No other drug can replace this effect. That's why it's the first emergency step in every heart attack protocol. After stabilization, low-dose aspirin, 75 to 100 mg daily, is continued lifelong. It keeps platelets less sticky, lowering recurrent heart attack risk by 25% and death by 10%. The same applies to ischemic stroke or transient ischemic attack, TIA. Once bleeding is ruled out by CT, a 160 to 325 mg dose is given within 24 to 48 hours, cutting the chance of a major stroke by 60% in the next 2 weeks. Then 75 to 100 mg daily is continued long-term. Aspirin is no longer advised for healthy adults just to protect the heart. For low-risk or older people, over 60, the bleeding danger outweighs the benefit. It's now used only if a person has high cardiovascular risk and no bleeding tendency. In peripheral artery disease, where leg arteries are narrowed or blocked, long-term aspirin helps prevent limb clots and reduces cardiovascular death by 25%. Sometimes, it's combined with very low-dose rivaroxaban, 2.5 mg times 2, for extra protection, but only under specialist care. Long-term studies show another benefit: cancer prevention in people with Lynch syndrome or a strong family history of colorectal cancer. Taking 75 to 100 mg daily for greater than or equal to 5 years can lower cancer incidence 30 to 40% and mortality 25%, by blocking COX-2 and reducing tumor-promoting inflammation. This, however, is not for the general population, only for high-risk patients under supervision. Even so, aspirin is not harmless. Its main risk is bleeding, especially from the stomach, which can triple with regular use. There are clear medical contraindications, situations where aspirin must not be used. The first is when a person has an active stomach or intestinal ulcer. Aspirin suppresses prostaglandins, which normally protect the stomach lining and neutralize acid damage. Without this protection, acid directly injures the mucosa, causing bleeding, ulcer recurrence, or even perforation. The risk of bleeding increases 3 to 6 times, and even one tablet can trigger it if an ulcer is already active. In older adults, or in those using alcohol, steroids, or anticoagulants, this bleeding can become fatal. Aspirin is also strictly avoided in people with brain hemorrhage, intracranial bleed, recent surgery or active postoperative bleeding. It's also prohibited in children and teenagers with viral infections such as flu or chickenpox. In this group, aspirin can cause Reye syndrome, a rare but deadly reaction that damages the liver and brain. Even with treatment, the mortality rate is up to 40%. Because aspirin blocks platelets for 7 days, even minor surgery, like tooth extraction or a skin biopsy, can cause prolonged bleeding. That's why surgeons usually stop aspirin 5 to 7 days before planned operations, unless it's absolutely necessary, such as after a heart stent. Aspirin is also not recommended during late pregnancy. It can cause premature closure of the ductus arteriosus, a vital fetal vessel connecting the heart and lungs before birth, and can increase bleeding in both mother and baby during delivery.